Hello everyone, I'm Nita. I'm the head nutritionist and lifestyle expert with Team Luke, and I'm also the head of skincare vertical. Let's discuss all about snail today. Nail for women, more than men, have always been more of an accessory, something that is used to define one's beauty. Going for manicures and pedicures tends to be a me time for many women. But did you know that your nails are also a window to your health? Looking at your nail, you can actually gauge what's going in inside your body. Yes, nails are not just there to protect your sensitive tips of the fingers from accidental trauma, but the structure and appearance can give you an insight of any vitamin, mineral deficiencies, infections, and so on. Nails are formed by the layer of germinal tissue called the nail matrix. The nail bed is underneath the nail and attaches a nail to the finger. The nail matrix is located at the base of the nail and is where the nail growth originates. The cuticle connects the top of the nail plate to the skin behind it. Nail fold anchors the nail to the skin and forms a cuticle. This prevents microbial growth or microbes from entering the nail bed and also keeps the moisture out. Now, some changes in nails are due to medical conditions that need attention. There could be symptoms like discoloration, dark streaks, white streaks, changes in nail color, changes in the shape of the nail like curling or clubbing, changes in the thickness of the nail, either the nail become too thick or they start to thin. Nails that become brittle, nails that are pitted, bleeding around the nails, swelling or redness around the nails, pain around the nails, and nails separating from the skin. These are a few medical concerns that you might want to pay attention to. These nail changes can be caused by different diseases. People who have alopecia areata, lichen planus, atopic dermatitis, or psoriasis may develop something called as trichonychia, which is rough, opaque nails that have ridges and sandpaper like appearance. Children are most commonly affected by trichonychia. Nails can become discolored for many other reasons, such as smoking, use of tobacco, use of hair dyes, even certain medications such as chemotherapy drugs, infections of the nail bed, injury to the nail bed, melanomas, silver toxicity, and Wilson disease, where the nails become bluish in color. Systemic illnesses such as liver diseases, where nails become white, renal failure, where the nails start to break, aging also causes nails to become dry and brittle, flat or concave instead of convex. They may develop ridges along their lengths, and nail color may change from yellow to gray. Now, some other nail abnormalities include fungal infection. Onychomycosis is a fungal infection involving any component of the nail unit. This causes pain, discomfort, and disfigurement. Common signs of nail infection include a distorted nail that may lift off the nail bed, the odor coming from the infected nail, and brittle or thickened nails. Thickening of the toenail is a normal age related change that happens in everyone almost, but abnormal thickening is also possible. This includes injury, fungal infection, ischemic circulation being compromised, arthritis, abnormal gait, and even psoriasis. Longitudinal ridges running down the nail may occur in several systemic conditions such as severe anemia, malnutrition, aging, trauma, eczema, rheumatoid arthritis, peripheral vascular diseases, and lichen planus. The nails may flake into layers as it grows due to the constant application and removal of nail polish and hands being in constant exposure of water as well. This is not really a medical concern per se, but yes, the chemical itself is causing the nail to get damaged. Clubbing is when your nails thicken and curve around your fingertips, a process that generally takes years. But this can also be a result of low oxygen in the blood and is associated with cardiovascular diseases, inflammatory bowel diseases, liver diseases, pulmonary diseases, and even AIDS. If your fingernails have raised ridges and scoop outwards, it is called as spooning. Sometimes the nail is curved around enough to hold a drop of liquid on top. Spooning can be a sign of iron deficiency anemia, heart disease, hemochromatosis, lupus, hypothyroidism, and even Raynaud's disease. Non-uniform white spots or lines on the nails are called leukonychia. They are usually the result of minor trauma and are harmless in healthy individuals. Sometimes leukonychia is associated with poor health or nutritional deficiencies. Factors can include infections, metabolic or systemic diseases, as well as certain drugs. Pitting refers to small depressions or little pits in the nail. It is common in people who have psoriasis. When the tip of each nail has a dark band, it is called as Terry's nail. It is often due to aging, but it can also be caused due to congestive heart failure, diabetes, or liver disease. This is when the nails get thicker and fail to grow as normal or as fast as normal. Sometimes the nail lacks a cuticle and may even pull out from the nail bed. It results from internal malignancies, lymphedema, pleural effusions, respiratory illnesses such as chronic bronchitis, sinusitis, and rheumatoid arthritis. Bruise lines or depressions that run across fingernails are called bruise lines. They can be a sign of malnutrition as well. Other conditions that cause bruise lines include high fever, measles, mumps, scarlet fever, peripheral vascular disease, pneumonia, uncontrolled diabetes, and even zinc deficiency. Now, if you see any of these signs in terms of your nail health or the appearance being altered in such a manner, you want to investigate deeper because at times a lot of the symptoms that we see, be it your skin health or brittle nails or any deformation that you see on the nails, is always a sign of what's happening internally. So, you may want to run some blood tests to see what you're deficient in. You may want to look at your liver health, your heart health. You may want to see if your sugar has been uncontrolled and on a very high side, even if you know you have diabetes. And addressing those concerns will take care of the physical appearance of your nail, which basically means that your health will improve and therefore the nail regeneration will be possible. Now, here's how you can take care of your nails through lifestyle, just in terms of maintaining the appearance and integrity of the nails. Avoid biting or tearing of nails. Keep your hands clean and dry and protect them from chemicals and trauma. Use sharp manicure scissors. Trim your nails straight across and then rounding the tips gently. This will prevent nail ingrowth from happening. Use nail clippers and trim them after a bath when the nails are still soft. So it makes it easier to trim the nails without causing any kind of hurt, bleeding, or damage. You can also try working on your nail health through food, as we know that a lot of these conditions may arise out of certain deficiencies in the body or when the body is lacking certain vitamins, minerals. It's very important to take care of your nutrition first so that your nails, skin, hair, everything is growing to the best of its ability and has no deformities. Biotin is a B vitamin which plays a very important role in not just nail health but also your skin and hair, as many of us are aware already. It promotes healthy cell growth and aids in metabolism of protein building amino acids that are essential for nail growth. Biotin is most concentrated in organ meat such as liver, but can also be found in egg yolks, dairy products, but make sure it's organic, yeast, salmon, avocado, sweet potatoes, nuts, seeds, and even cauliflower. Disease can result in discoloration of your nails. Folate can be found in dark green leafy vegetable, citrus fruits, peas, lentils, nuts, seeds, and avocados. B vitamin is primarily present in animal foods such as meat, poultry, fish, eggs, and dairy. But even sprouts have a good amount of B12, so you want to include sprouts in your diet. And of course, even if you're a vegetarian, including curd is something that you may look at, but source it ethically, source it from an organic uh, vendor itself. Iron is also needed to provide your cells with adequate oxygen, which in turn is necessary for healthy nails. Iron deficiency anemia can lead to vertical ridges in your nails or can cause the spooning of the nails or make them concave. Adding vitamin C rich foods together with a plant based iron rich food helps in better iron absorption. By this we mean if you're including dark green leafy vegetable for your iron, you may want to include some amount of lemon juice to it for improving the bioavailability and absorption of iron from your green leafy vegetable. Similarly, if you're including something like garden cress seeds or a leaf, as we call it in Maharashtra, including a few drops of lemon juice to your garden cress seeds in a glass of water will help in better iron uptake. Adequate magnesium intake is also crucial to prevent vertical ridges of the nails. This mineral helps in protein synthesis and formation of new nails, including raw cacao nibs, dark chocolate, of course, but again 70% and from a good organic source, dark green leafy vegetables, almonds, cashews, peanuts, edamame, which is tender soybean, black beans, are good sources of magnesium. Omega 3 fatty acids help to lubricate and moisturize the nail, which leave them shiny. They may also help to reduce inflammation of the nail bed, which nourishes and promotes the health of cells that give rise to the nail plate. A lack of omega 3 fatty acid in your diet could contribute to dry and brittle nails. Eating enough of protein in your diet is extremely essential to boost keratin production. Keratin is basically a protein out of which our nails and hair is made up of. So including good amount of protein in a balanced way helps to create strong nails, whereas a low protein intake leads to brittle and weak nails, including lentils, pulses, dry beans, lean meat such as fish and chicken to ensure adequate intake of protein is important. Vitamin C actually helps in production of collagen. Now we've studied about collagen in the past, where collagen forms a very important structure of a nail's hair, skin health. So, including vitamin C rich foods such as citrus fruits, berries, cherries, lemon, kiwi, guavas, oranges, amla, even are considered to be very important for our skin and nail health. Bell peppers, green leafy vegetable, and tomatoes are other sources of vitamin C. Zinc is also essential for healthy nail growth. Inadequate zinc intake can contribute to degeneration of the nail plate that causes an appearance of white spots in your nails. If you have brittle nails, you may want to try this application of vitamin E with coconut oil. So just take a few drops of vitamin E oil, mix it with cold pressed coconut oil, and massage the nails every day, at least twice a day, to see the benefit. Vitamin E is an easy yet highly potent and rejuvenating treatment for the nail. If you have fungal infection, using tea tree essential oil, just about 1 or 2 drops mixed with cold pressed coconut oil, can help in managing the fungal infection. You need to mix this and massage your nail bed 3 to 4 times a day till your fungal infection completely starts getting better. You also want to look at your gut health because fungal infection may arise from unhealthy gut and an imbalance in the microbiome as well. So use of probiotics helps, and eliminating sugar and refined food is very important for managing fungal infection. I hope this session is helpful for you to understand your health, understanding how the different appearance of the nails may not just be something physical, but a manifestation or a window to understanding your internal health and symptoms, and uh, bring helps to throw some light on how you can take care of your overall health. Let us know how you found this session, and let us know how these remedies work for you. Thank you.